Hi, my name's Elizabeth Mack, and I'm here to speak to you on behalf of Lumiere Clinic in the telehealth entrepreneur category. And I'm very grateful that you have accepted me as able to present remotely because I was injured last night, but with some TLC and CBD and some scans, I'm just right. So I'm happy to share my message to you because I still have that to convey. So our agenda today, people are making great medicines, people are selling great medicines, but nobody's interpreting how to use these cannabis medicines clinically for patients. And that's what we do. We're going to talk today about the journey of challenges in both healthcare and cannabis and how the ecosystem is the solution. We've been creating this patient-centered ecosystem for years in what we're doing in our patient care and programs, and we're going to talk about extending that. We'll talk about what the competition is and how we're building for legalization, which is a matter of when, not if, and then what we need to partner and get this done. So healthcare is fraught with challenges. I've been an RN for the past 35 years, and it pains me to hear that half of all nurses are considering leaving the profession. They suffer with compassion fatigue and burnout and staffing shortages that shortchange their life, and then futile patient care. Patients are sicker, costlier, and disease is almost always chronic now. Higher encounters don't solve anything. As we can see, we're spending $4.5 trillion in healthcare costs in this country and still placing near last-in outcomes for the developed nations. The pills and procedures leave us traumatized patients. We're seeing this every day in our patient care, and I've struggled with it for 2 decades myself. I had my first shoulder surgery back in 1993. I've had 3. I've had bicycle accidents, and I've never gotten hooked on opiates, but so many people do. Prescriptions that were meant for a 2 to 4 week course of treatment often end up in a 2 to 4 year period of time, which puts people in trouble. We have had overdoses accelerating in this country. Last year's numbers, 100,306. That's 274 people every day, 11 every hour. And just in the 12 minutes I'm speaking to you, that'll be 2 people. We have to stop this. And there's no root cause to healing these chronic illnesses within conventional care. When we're seeing these patients in our cannabis practice, cancer, chronic pain, neurodegenerative, neurological, autoimmune, metabolic, mental health, patients in the conventional care system often have no way out, and they're looking for different options. Cannabis is a solution for many people, and luckily we have 70% of Americans living in a medical legal state where they have safe access. But with adult use, it's kind of a free-for-all out there, and fear and stigma and lack of education persist when approaching it as a medicine. Cannabis as medicine still, we're in the innovator stage. Even before early adopters, we're just still dreaming here, but we're creating this. And the refractory cases of pediatric epilepsy led the charge. There's heavy research being done in Israel where they have state-sponsored programs on autism, cancer, and more. And the people whose lives have changed with medical cannabis, those are the ones that are leading the people-powered advocacy. And we need systems to help more people discover the health benefits of cannabis and not just leaving it with the grassroots. But the FDA is in the way. The natural botanical medicines can't cure, prevent, or treat any disease. Only FDA-approved pharmaceutical drugs can do that. And there's a poor understanding of health promotion through non-pharma pathways, and that stalls progress. We have so many great cannabis companies up and down, but 80% of them are not surviving because of federal stalling and lack of cooperation. But what we're building here is special with the Lumiere Clinic ecosystem. Lumiere Clinic will bring safe, effective, patient-centered care to those entering the medical door for cannabis. So we can work with them clinically. So our first route is telehealth nursing. So we'll have care by expertly trained nurses to educate, guide, and monitor patients who are new to cannabis to help in adoption, retention, and optimizing the use of it. Nurses are healers, they're educators in the most trusted profession for over 20 years. We can give nurses that are in their 50s that want a second shot at a different career, a new opportunity, and also people that are struggling with burnout, something that they can do with meaning and to see impact almost immediately with patients. We've created for years educational programs for patients and professionals. I wrote a book, Cannabis for Health, Become a Coach, that has turned into professional programs for healthcare folks, and then all of the patient programs that have how to use cannabinoids for symptom reductions and quality of life improvements with the latest research and dosing protocols by condition. And then we're creating an observational study platform where we're going to have app tracking, dosing adjustments with nurse-led treatments, informed protocols that we'll continue to refine and get smarter with, and then fun incentives, engaging patients in stronger holistic self-care. Integrated cannabis healthcare. I've been in healthcare for a long, long time, 35 years, and we're building something special here that is going to be side by side with conventional and alternative care. And that's important because the endocannabinoid system is the largest messenger signaling system in the body, more receptors and targeted in our cell membranes than any other cell receptors in our body, controlling things, CB1, our mind, our memory, our motor functions, pain perceptions, temperature, appetite, sleep, all of that, CB2, our immune systems, our health, all of this is being bioregulated by the endocannabinoid system moment by moment, keeping us alive and at homeostasis. And when the US patent was filed in 2003, they said at the NIH, this has therapeutic potential for all diseases in modulating the endocannabinoid system. And so patients are using cannabis. Let's talk about how to use them clinically for healing potential. One is our nurses who will be case managing patients, answering calls on the nurse line, and then taking them as needed into one-to-one counseling care, and then eventually condition care groups where we'll be having people that have like situations where we can coach them together. We're going to be saving time and money as people experiment with this option, reducing side effects and improving outcomes of care. We're going to give them guidebooks for safe supplementation with CBD, THC, and then all of the different routes of administration, products, talking about bioavailability and basic dosing titration. We are creating a vetted marketplace with quality CBD formulations, near GMP certified formulations and protocols that are then going to be able to help us take that into contracted markets with THC, with people that we will be creating products and formulations with and then put into distribution within states so that we can create programs and a formulary that will have greater affordability and access for patients across the country. We'll be storytelling our success with High Science. We have been chosen to work with them and are going to create a Netflix documentary where we're going to be sharing how we're working with patients around the world with our partners, and then having testimonies about how this is working to build media awareness for Lumiere Clinic and all of what we're doing. So we will be advancing real-world evidence data collection in new research, formulations, publishing the white papers of data and efficacies and outcomes so that we'll truly know how people are reducing the pharmaceuticals that they're taking and to map out how to do this for other people. The competitive landscape, number one, is the status quo in healthcare. The pharmaceutical companies, insurers, hospitals, doctors, and all the service providers, people stop using pills and procedures when cannabis is successful. They're mapping that out in Canada, where they have federal legalization and seeing reductions across the board in pharmaceuticals. And over here, those bioscience companies, Jazz Pharmaceuticals, makers of Epidiolex. Epidiolex is a FDA-approved CBD. CW Botanicals just got the MLB contract for CBD in this country. And then recreational adult use, cheap THC is going to help through the bud tenders who cannot practice medicine, but it's good for replacing alcohol with consumption lounges, social equity programs, repairing the war on drugs, but none of these people are focusing on the patient clinical focus, which is that's what we do. So nurses are still burnt out and patients are still left out. So what we need from a technology standpoint as we build our cannabis HMO, the same thing everybody else needs. All of the EHR, the geofencing, the patient portals. Our patient care right now is through air call for our nurse line, and then Zoho meetings, Zoho One for everything. In our telehealth appointments and our messaging, we want to put our educational programs into this network, app tracking to measure symptom reductions, quality of life improvements, biometric changes, improvements in sleep, etc. Having a clinician interface with supply chain menus based on outcomes and efficacy results that can lead better performance, and online ordering for patients, and then mapping the gains in disease management categories to inform future clinical trials, and of course, insurance reimbursement. I spent my first 10 years in hospitals and my next 20 years in insurance companies. Last job was regional sales manager for Anthem Blue Cross at the County of San Diego, managing all the employee benefits programs. Sherry Tuckus, the green nurse, spent the last 30 years in Boston Systems and all of the Harvard systems, Beth Deaconess and Brigham, etc., working as a clinical nurse liaison, very top positions. And then we have Canam Group, which is a licensed producer with operations in Jamaica, Canada, Australia, distribution in EU, UK, and Americas. And then we have a stellar team. And together we will remedy the disorganized adult use with cannabinoid healthcare, featuring integrated patient-driven solutions. So in conclusion, we're losing billions of dollars and far too many lives. Medical cannabis states have 25% fewer overdoses and all of the ramifications of that. Patients need a cannabis and holistic health hub for healing, where we teach them about the endocannabinoid system, how to maximize the benefits, minimize the harms, and stay safe in using this as a therapeutic option. So we hope you join us. Cannabinoid solutions can heal us from conventional care. CBD healed us, and we're building the future for patients all over the world. I love the phrase Tikkun Olam. It's Hebrew for heal the world. So join us and email me for further contact and any questions on helping us. We need funding and partners to make these dreams come true. So God bless and thank you.